The 2008 International AIDS Conference, brought to you by KaiserNetwork.org.
Today, the 17th International AIDS Conference focused its attention on methods for preventing HIV infection. With an effective vaccine years away and other tools like microbicides and pre exposure prophylaxis still being researched, bringing together stakeholders is of vital importance. The University of North Carolina at Chapel Hill's Myron Cohen.
We cannot have all these separate fields. So the treatment field, the prevention field, and the community have to come up with a unified strategy to work together to use all the agents we have. And this is going to be so important if microbicides work and if the antiviral PrEP works, because these communities need to be one community by the time we get the results of those trials, or we won't be able to implement what we're already doing.
According to a report released today by the Global HIV Prevention Working Group, behavioral interventions aimed at unsafe sex and drug use represent one effective existing prevention strategy that could be far more utilized. The group's research shows evidence-based behavior change strategies have been associated with an overall decline of 50 to 90% in HIV infections for key populations. Helene Gale with CARE USA is a working group member.
Is that these programs work and can have a dramatic impact on preventing HIV infections. In all cases in which national HIV epidemics have been reversed, broad-based behavior change was central to that success.
Reducing stigma among marginalized and high-risk groups, especially men who have sex with men, was also discussed as important to stemming the spread of HIV. Jorge Saavedra of Mexico's National Center for HIV/AIDS Control and Prevention.
Just a few countries of the world are addressing this issue openly, and we think that a lot of the barriers to access not just health services, but also for testing, for other kind of services, is stigma, discrimination, and homophobia.
Another barrier HIV-positive people face, travel restrictions, with a handful of countries still barring them entry. Susan Timberlake is with UNAIDS.
People in today's world view mobility as a human right. They view it as an integral part of their life. So it is time to realize that these dinosaurs of discrimination that take the form of keeping out 33 million people living with HIV have to go.
In Mexico City, Jill Braden-Balderas with KaiserNetwork.org.